Hey, this is Eugene. Thanks for joining me. This video is going to be a little bit different than what I've done in the past, and I'm actually going to be with an agent who is using my Train Telemarketers program, and I believe he has 3 right now where they generate leads for him and his business, and he's been doing 65 plus up until this point, and I'm helping him transition into the T65 market, and so he's gonna needs a little bit of coaching to help hit the ground running when it comes to the presentation and what to say and how to build a credibility with a customer and what to do with the application process. And so I said that I would do a one-on-one call with him, and something that I asked him if it's okay if I share it with the YouTube community, which is what we're going to be doing here. And so in this presentation, or in this video, I'm going to talk about my Turning 65 presentation and my talking points, and really lay out my script and how I approach these calls. If you have any questions about my Train Telemarketers program, if you have questions about my Data Download Center program, where we can pull names of people who are turning 65 or have been on Medicare for a little while, or really just about any kind of data you need, links will be in the description below. If you need one-on-one consulting and you really need help getting up and running, I'll have my email as well in the bottom in the description, so just feel free to reach out and I can go over the details with you as well. And if you want to do it exactly how Tyler's doing it, just reach out and I'd be more than happy to help. Remember, I'm an insurance agent first, so I sell insurance full-time. Anything related to traintelemarketers.com, datadownloadcenter.com, all of that is more of a side hobby that I really enjoy, just helping other agents. But I am an insurance agent full time. This is what I do. I love training agents on how I do it. So I hope this video is beneficial to you. It is a little bit of a long one, but it is my Turning 65 presentation. I hope you enjoy. Thanks. I have here with me Tyler, and Tyler has been a customer of the Train Telemarketers program, which I'll have linked in the description below. And Tyler, you've been using the program for a little while now, and you've been doing it on the 65 plus
Mhm.
campaign. But then I guess we're making that change to the T65, which is something that's completely brand new to you. How's your experience been with the 65 plus?
Yeah, 65 plus has been really good. I just been kind of wanting to get more into the T65s, but I've been definitely getting a good lead flow. It's been working out really well. I've been happy with it, but
How
I
many
just want.
telemarketers do you have?
Now I just added on the third one, so it's been going pretty good. I had one for a good while, and then added the second and third one. You know, um, Kind of at the same time. So it's been probably almost a year, I want to say, total from the start, but it's been going pretty well.
And
And again,
you have a still to this day you have a full-time job elsewhere, and a lot of
yeah,
agents that I talk to are doing this part-time, trying to get enough of a book to where it can replace their income before they feel comfortable in.
yeah, exactly.
Yeah.
So,
So you have
mhm.
a full-time job now, and tell me about your schedule. So when you're off of work to when you come home, or how do you work your schedule?
Yeah, so that's kind of actually a good point of like I kind of why I want to go more to the T65s. So, I have my full time day job as an engineer and just trying to build up my book. So I get home probably, by at least 5 or 6 and get the kids to bed and everything. And after that, I can probably start calling at like 7:30 Eastern time. And my strategy in the beginning with the T60 or the 65 plus was getting some states out west so I could talk to them at an earlier time so it's not so late for them. And that worked out pretty well. And now I'm trying to kind of transition into that T65 where this is like the most optimal time for them anyways. Like when they're getting off work, I'm getting off work. So it's
Yeah.
kind of perfect. And that's why I'm trying to move over to that. And that's kind of why I wanted to kind of have this call with you so we can kind of go over what maybe I should say, because I'm not
Yeah.
really sure. I'm like really good with the 65 plus, but T65, it's like a whole new world for me. So,
Yeah.
um,
And that's, and that a lot of agents who are starting out, they're so hesitant, and they don't really know which should they be doing, T65 or 65 plus. And what I tell people is 65 plus, so the replacement market, I would say is easier, but because there's not a whole lot of educating as much as there is just building a relationship and then saying, hey, look, you're overpaying, let's fix that. But with the T65, and the reason why we're having this call is we're going to, and I'm going to give you exactly how I do my T65 presentation. That way you can, write out a script. And that's the reason why I wanted to share this with the agent communities, because there's a lot of people that are in exactly the same situation as you are. Now, and I'm going to throw this out there for the video, but I do normally charge for this types of trainings. So if an agent is watching and they want some in-depth one-on-one hand-holding where I show you the scripts and the techniques and all that, I'll have my information linked in the video below. But Tyler, so what we're going to do is we're going to talk about the turning 65 market, which is a completely different conversation than the 65 plus market.
Mm-hmm.
And so what I'm going to do is I'm going to first break it down into categories of developing a script, and then I'll actually go through my entire script, and you can transcribe it and send it to me and I'll look at it. But the most important part, I think, in the T65 is setting yourself apart from the rest of the phone calls that they're getting. And in the very beginning, when you get a lead, and I don't care if it's telemarketed, if it's direct mail, if it's a Facebook lead, I mean, there's so many different ways to do it. But when you call somebody back, you want to remind them of why you're calling them. And so the introduction, just like with telemarketing, the introduction is very important. The introduction, the first couple words that you say really set the tone for the rest of the conversation. And so I always say, hey, this is Eugene, not Eugene Marchenko with whatever, blah, 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 company name, American Insurance Benefits. I don't do any of that. I just say, this is Eugene, because I'm a stranger. I don't want to waste their time in trying to introduce myself with all my credentials. I'm a licensed agent. I'm trying to sound different than the 100 phone calls or so they got prior to me calling them.
Mm-hmm.
And so we have to remind them why it is that you're calling them. And so you're trying to say, I'm giving you a call back. And so the beginning of the call, we want to make the conversation about them, not about me. Now, hey, this is Eugene. I'm a licensed agent in South Carolina calling you back. I want to help you with your medical. No, what you're trying to do is you're trying to sell them. And so what I say, I take the approach of, I want to go over the information that you're getting in the mail. So I say, hi, this is Eugene. I'm giving you, about them, a call back. You, again, you spoke to my assistant, or you filled out this piece of information, or it doesn't matter. But in Tyler's, your situation here, you're doing the telemarketing. So you, the client, you spoke to my assistant about the information that you're getting about your upcoming enrollment into Medicare. You, yours, not me. It doesn't matter who I am, right? And so, hi, this is Eugene giving you a call back. You spoke to my assistant about the information that you're getting about your upcoming enrollment into Medicare. Have you started going over the information that you've been getting in the mail? No. Okay. That's the reason why I'm calling. Now is the time to go over the information that you're getting. So another thing you can say is, well, you're turning 65. You want to get them to say, yes, you're turning 65 in August. Is that right? Yes. Okay. Well, the reason why I was calling is to actually go over the information that you've been getting in the mail about your Medicare enrollment. Where are you, open-ended question, where are you in the process of going through the material, not picking out a plan, not choosing a company, not making your decisions? Have you bought something? None of that, right? Where are you in the process of going over the information that you've been getting in the mail? And just let them talk. And at this point, you're giving them an opportunity to vent. I'm getting tired of all these calls that I'm getting, and I'm getting so much stuff in the mail. And you're like, Miss Smith,
I hear that all the time. So what you did is now it's a group mentality. You said, hey, I'm a professional. This is something that I'm used to dealing. I hear the symptom. I got a solution for you. I'm a doctor, right? But at the same time, you're like everybody else. And I've dealt with your situation before. And this is all subliminal, right? And so I'm here to help you. Yes, Miss Smith, I hear that all the time. You're probably getting a bunch of stuff in the mail, haven't you? Yeah, I've just been stacking it off to the side, or I've just been putting it away. I don't even know where to start. Okay. Well, the reason why I was calling was to actually go over that information with you. And notice, because remember when we did the 65 plus conversation, you're repeating yourself a lot.
Hmm.
So that's kind of the same thing. So you already said that you're calling to go over the information, you let them vent, and then you say it again. So, well, that's the reason why I was calling. Now you're making it more personal because they just vented to you saying that I just got a bunch of stuff in the mail. I'm getting a lot of phone calls. I don't know what to do. I don't know why you people keep bothering me, which happens all the time. And you say, I hear that all the time, and that's the reason why I was calling, was to actually go over that information with you. Now, do you remember seeing anything in the mail that's about 150 pages long or so? It's a red, white, and blue book. It says Medicare and You up at the top. Depending on where they are in enrolling into Medicare, so if they're like maybe 1 or 2 or 3 months out, they might have gotten that Medicare and You book. But if they're like 4, 5, 6 months, which by this time they're just getting the phone calls, they're getting the stuff in the mail, but Medicare and Social Security haven't really sent them anything yet. And so you get to be the hero and you say, well, everything that you're getting in the mail right now, most of it's just junk mail, and we're going to get rid of 95% of that stuff because a lot of it's not relevant to your situation. And all those, Miss Smith, all those phone calls that you're getting, all that stuff in the mail that you're getting, that's all, those are all advertisements of companies trying to sell you something. I don't want to sell you anything. So now you're building credibility about yourself. So you
Hmm.
made it about them. You let them vent a little bit. Then you say, because what you're trying to do is you're basically trying to say, here's what I'm going to do for you. And if you don't like it, let's part ways. And we wasted no more than 5 minutes of each other's time. But then you say, okay, so what I'm going to do is I'm going to help you go over all that information. You'll throw away 95% of the stuff because that's all sales pitches. None of that stuff really matters at this point. And what I do is I help folks like you learn and understand how Medicare works. I promise you, I'm not going to try to sell you anything. That's not the purpose of this call. I am a broker, so I work with all the companies, but I work with Medicare beneficiaries like you, again, like you, professional here.
Hmm.
They'll talk to a lot of people. And what I'm going to do is I'm going to help you first understand how Medicare works, then help you understand all that stuff that you're getting in the mail. And then you'll know what to throw away, what to keep, what's relevant, what's not. And that way, whenever you are ready to make a decision, you're doing it based on information, not based on a sales pitch. And Miss Smith, I promise you, I'm probably going to be the worst salesman you'll ever talk to because I'm not going to try to sell you anything. How does that sound? Usually they say that sounds pretty good, if they let you get that far.
Yeah, that's probably the trick.
But I think they'll let you get that far if you you're sincere. You're already
Hmm.
standing. You're going to stand out from 95% of the call centers that they're getting calls from because you sound different. You're not trying to sell them anything. You're trying to help
Hmm.
them. You're trying to educate them.
Yeah, makes sense.
Then you say, well, going back to the red, white, and blue Medicare book, did you get anything in the mail that looks like that? Yes or no? No. Okay. Well, I'm gonna go ahead and get that out to you. But there's and if you do have it, do you mind getting it out? And depending on whether or not they have it, if they get it out, you want them to go get it. So if you don't mind, go ahead and grab that. We're gonna work out of that book. Now notice how that I didn't ask is this a good time? I didn't ask, are you okay with going over that right now? I'm very assumptive when it comes to this part. And so I said, go ahead and get that book out if they have it. If they don't have it, You say, so what I'll do is I'll make sure to get that out to you. What's a good email address for you? I'm gonna go ahead and throw that in an email to you. Now you have their email address, so that's one piece of information that you can collect right there and then. And then if they don't have it, then you say, okay, go ahead and grab a paper or something to write on and a pen. Let's start with the basics of Medicare and how Medicare works. And then we'll just start taking this puzzle piece and start putting it all together so that way it makes sense for you. And then they'll usually say, well, now's not a good time, or they go and get it, they go get their book or whatever. But the whole idea here is you want to get some kind of commitment from them that yes, they are going to be talking to you, or the flip side is no, they're not talking to you, not because they don't want to, but because right now is not a good time. And then you find out when is a good time. And if, let's say, you're going to go schedule the appointment, so you're scheduling it, what you say is, what I'll do is I'll send you my contact information in a text message or an email, but I can just text it to you. Is this the number that we're talking on now? Is this a good number for me to text? And if they say no, just say, well, what is a good number? I'll go ahead and text you my contact information. So if that happens, and notice how you didn't volunteer it. You didn't say now's not a good time, is now a good time. You just assumptively said, go ahead and get a pen and paper, or go ahead and get that Medicare new book out or whatever, and you had them stop you. So if they do stop you, then you say, okay, well, let me text you like what I just did earlier. And then they give you their cell phone number. When you text them, you want to give them your first name, your last name. You want to give them the company name. So like my case would be Eugene Marchenko, American Insurance Benefits. A link to my website if you have a website. If you don't have a website, it's okay. You can leave that out. And then I always like to send a picture of my license, of my insurance license.
Gotcha.
And just say, hey, for our call tomorrow or whenever, I look forward to talking to you. Here's my contact information, but I'm also going to send you a copy of my license because eventually you are going to need it. And I just want to make sure you have that now, so that way you know that I'm a licensed agent. And I'll actually do that in a text message.
So you just send them the state, whatever they're in, obviously, right?
Yeah, exactly.
So we just go all over.
Yeah,
Okay.
yeah,
Gotcha.
exactly. Now, if I'm, hopefully I don't get in trouble for this, but if, let's say I'm talking to somebody in a state I'm not licensed in, let's say I was testing a state for some marketing purposes and I got somebody on the hook, as I'm talking to them, I'm filling out that licensing information so that way I can get licensed, because I have a pretty good idea if a conversation is going to go towards a sales, a close or not, just based on the first couple minutes of the conversation. So I'll go ahead and get licensed, pay the $60, $80, $100 or whatever. And if for the time being, because it usually takes about 24 hours for the license to come in, I'll send them a picture of my resident license. And then as soon as I have the other one, I'll send the other one. So, okay, so assuming that they got their pen, they got their paper, okay, they're writing stuff down. And so essentially, and I'm going to do a quick screen share. Okay, let's see here. I was buying some plane tickets, so okay. So Medicare and You 2022, share screen. Let me just share this with you. So essentially, what we want to do, you can see my screen, right?
Yep.
Okay. So essentially what we want to do is on page 5, this is essentially what we want to paint them a picture of, but I don't want them to turn to page 5. So if they have their Medicare book, I'm not having them turn to this page. I say, go ahead and turn to like the back cover or whatever, and just go ahead and write this down here, because I want their notes to be together, right, with this book. And then at the end of this part of the presentation, when I'm done with it, then say, all this is now summarized for you on page 5. But page 5 looks a little confusing, and so I want them to have my interpretation or my explanation of it. So that way, because like if you look at the right-hand side of this thing, it almost makes it seem like you get Part A and Part B. Like it's very deceiving, right?
Mm-hmm. Yeah,
That's
yeah.
not true. You don't get Part A and Part B if you have Medicare Advantage. You get hospital benefits like you would under Part A, and you would get medical benefits like you would under Part B, all lumped into one plan. But that's not the same thing as having Part A and Part B like it looks like in this illustration. And so I want them to write it down first. And essentially, so I'm done sharing my screen for right now, but this is kind of what I want it to look like. But
Mm-hmm.
on the left-hand side, I put original Medicare like they do. So it's a T chart, right? Just down the middle and across. Original Medicare on one side, and then Med Advantage on the other. And so what I do is, let me see if you can see it. So T chart, original Medicare, Medicare Advantage. This is essentially what I want them to draw. And then I tell people, okay, so go ahead and write this down on your sheet of paper or whatever. Just draw a T chart, so like a big T in the middle of your paper. And we're going to divide your piece of paper into 4 sections. We're going to talk about original Medicare on the left-hand side and Medicare Advantage on the right-hand side. What's funny is like when I look back at my conversations when I'm talking to people, I'm actually like using my hands like I am right now, which helps me explain stuff. I don't know why, even though
Yeah.
but I feel like it, you know, like when you're new to sales, they have you put that mirror in front of you to see what you look like. That's just the way I do it. So on the left-hand side is original Medicare, Ms. Smith. On the right-hand side, go ahead and Medicare Advantage, right? Medicare Advantage. So what we're going to talk about first is the different parts to Medicare, and we're gonna summarize how Medicare works, so you don't have to read this 150-page book that you have or may not have, depending on where you were in that part of that conversation. And I'm going to briefly explain to you how the different parts to Medicare work. And essentially, with you understanding how it works, you'll come to making your first decision on which direction you want your health benefits to go. Okay? So on the left side, under original Medicare, go ahead and put Part A, and then put dash hospital benefits. Then under that, go ahead and write Part B dash medical benefits, which is like your doctor's visits, your preventative care, so on and so forth. So if you end up in the hospital and something major happens to you and you have to sleep there, your hospital Part A bill, or your hospital bill will be picked up by Part A. Then if you go to a doctor's visit, colonoscopy, x-ray, CAT scan, whatever, and you have some kind of regular doctor's visit, that's where Part B comes in. So simply put, and I always say so simply put, or generally speaking is another term that I like to use, you don't want to speak in absolutes, because the Medicare new book speaks in absolutes. That's what's making it confusing. Your $1,400 or $1,500 deductible under Part A, blah, 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 all that stuff. I don't go into any of that because I don't want to confuse them. So I say, so the first thing is Part A is your hospital benefits, Part B is your doctor's visits, your medical benefits. Generally speaking, Part A and Part B will make up about, not general, or not absolute, but general, about 80% of your benefits. Now, if you go to a doctor and they do some kind of lab work or test, or if you have some kind of outpatient procedure, you're gonna have to meet a deductible, which is your Part B deductible. Once you meet your deductible, then Medicare will cover you at about 80%. The problem with that 20% that you're responsible for, the problem with that is that there is no cap on that 20%. So it could be 20% of 100,000, it could be 20% of $500,000, it could be 20% of 1,000, which is still a lot of money. And so you have a couple ways to put a cap on your out-of-pocket. The reason why I don't say put a cap on that 20%, because if they go with the Medicare Advantage route, it's not 80-20% coverage anymore. It's a whole different ballgame. But if they go with the Medicare, original Medicare, then yes, it's 80-20. But I want them to know that they can put a cap on their 20%, or a cap on their out-of-pocket with either Medicare Advantage or a Medicare supplement plan. So with original Medicare, Part B is going to cost you, what is the new rate now? 170.
Part B premium 170.10, I think.
Yeah, 170. Yeah. So you're gonna pay that for part A is not gonna cost you anything because you pay for it with your taxes. Part B is gonna cost you 172.50 or something like that. And that's gonna, now it could be more based on your income, and Medicare will let you know if you have to pay more. But if you're single and you've made less than $80,000, you don't have to worry about it. Or if you're married, less than 170 or 180, whatever the numbers are. And I always forget, but I always Google it as I'm talking during this part, so just so I can look it up. But I say, so Medicare is going to cost you $172, and that's going to pay for your Part B. And remember, you're responsible for 20% of all your expenses if you don't have some kind of cap on your out-of-pocket. And the way that you can limit your out-of-pocket exposure is a couple different ways. You can do it through a Medicare Advantage plan, which is the right side of your paper. So Medicare Advantage is also known as Part C of your Medicare. And what they do is they give you hospital benefits like they would under Part A and medical benefits like they would under Part B. However, all that's rolled into one plan that's managed by a private insurance company. So unlike Medicare, which is managed by Medicare and CMS, which is, if you will, the parent company of Medicare, Medicare Advantage, your benefits are through a private company. And each company under Medicare Advantage is different. And unlike original Medicare, unlike the left side of your paper, on the right side on the Medicare Advantage, you have to go to their doctors, you have to go to their hospitals. You want to make sure that when you're getting a Medicare Advantage plan, that you want to make sure, sorry, I lost my train of thought. You want to make sure that your doctor's visits are, your doctors are covered. So if you see any specialists, if you see more than one doctor, you want to make sure that they're all covered. You have to go to their doctors, you have to go to their hospitals that are in network. And if you go out of network, you may end up paying more. That's the right side of the paper. On the left side of the paper, original Medicare, Medicare itself does have a network, but Medicare's network is really, 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 really big. Whereas Medicare Advantage plans, they're very specific based on the area that you're in. And being even just one county over, the plan that you're in may change. The recommendation on the plan may change. And whereas with original Medicare, as long as the doctor accepts Medicare, you can go to any doctor, any hospital, anywhere in the country that Medicare is accepted. Now, if you decide you want to go with the Medicare Advantage plan, they all have their maximum out-of-pocket. So you choose the plan not only based on the doctors that covered, but what your maximum out-of-pocket would be, meaning the X number of dollars that you're going to be responsible for in any given year. And of course, those numbers change depending on if you're in network or out of network. Whereas with original Medicare, if you get a Medicare supplement, with original Medicare, the other way you can put a cap on that 20% is with a Medicare supplement. So you can't have a supplement with Medicare Advantage, but with Medicare supplement, you can have with original Medicare, you can have a Medicare supplement. And unlike Medicare Advantage, where you have to go to their doctors or their hospitals, with a Medicare supplement, you can go to any doctor, any hospital where Medicare is accepted. Now, any questions so far?
No, that sounds pretty straightforward.
Yeah.
And I'm just assuming you just kind of say about how there's premiums on one side and not the other.
Which is,
the next
that's
thing.
gonna be my next thing. Yeah, talking about money now. But also, just like I did with you, and I kind of did that on purpose, just kind of like I did with you, where like I stopped right there because I just rambled for a very long time. I stopped. I'm like, do you have any questions? You want to check in with the person. At this point, they usually will have a question or two just to clarify. And after that, they'll usually start talking, well, how much does each one of those cost or whatever? And you say, well, that's a good question. That's actually the next part that I wanted to talk about. So
Gotcha.
with Medicare Advantage, the a lot of times you don't have to pay anything in addition to your original, or you don't have to pay anything in addition to the Part B premium when you're on Medicare Advantage. So a lot of these plans are zero premium plans. You don't want to say the word free because you can get in trouble for saying free because it's not free. There are zero premium plans. So meaning you don't have to pay anything in addition to Medicare to get on a Medicare Advantage plan. Now, other plans may cost $10, $15, $20. Of course, that depends on which plan covers your doctors and which plan doesn't cover your doctors. But relatively speaking, the right side of the paper, Ms. Smith, Medicare Advantage isn't going to cost you very much, if anything at all, out of pocket for the premium. As far as original Medicare, if you do decide to get a Medicare supplement, you can get a Medicare supplement that will cover all your doctors, all your hospitals, pretty much anywhere in the country as long as Medicare is accepted. And you just pay one premium and you can just go. So if you travel, if you even go one state over, two states over to visit children, grandchildren, if you go overseas, if you go on cruises, you want to make sure that you're careful which one you decide on, because with Medicare Advantage, you'll have a lot of restrictions, or you'll have more restrictions with Medicare Advantage than you would with original Medicare. And the Medicare supplement travels wherever your original Medicare goes with you. And so with the left side of the paper, with original Medicare, the Medicare supplements typically have a premium. Depending on the rates and your zip code, it can range anywhere between $70, $80, $100 a month. And at this point, I've already looked up some rates. Like I already have a rate pulled up. So
Yeah.
whatever rates I'm giving them, because you don't want to say, oh, it could be as low as $70 a month.
Yeah.
Well, shoot, no, they're in Florida and it's $210 a month. So just be careful about the range that you give them. So you want to make sure you already have some kind of rates pulled. And you say, so anywhere between, like in South Carolina, Plan N is like $75 a month. So between like $75 and $110 a month, depending on the company that you choose. See how I put the ball back? Like It's your decision, right? So to summarize, with Medicare Advantage, you're going to pay less in monthly premium, but you'll have a little bit more restrictions or hoops to jump through when using your coverage. You got to go to their doctors, their hospitals, there's co-pays involved. Whereas with original Medicare and the Medicare supplement, you're going to pay more in monthly premiums, but you're going to have a lot less out of pocket, because with original Medicare and Medicare supplement, you're going to have essentially 100% coverage with anything major that happens to you, and may or may not have a small copay depending on which plan you go with. Any questions? And so they may ask some questions or whatever, and then you say, so this is really the first major decision that you're going to need to make, which is if you want to stay with original Medicare or if you want to go with Medicare Advantage. Based on the information that I gave you, which way do you think you're leaning more towards? And let them decide. If they're saying, well, I can't afford an extra $100 a month, they're already taking $170 from me or whatever, right? Then obviously that's more of a, hey, they're trying to do a Medicare Advantage. And then, like, if you're an agent who doesn't do any Medicare Advantage at all and only does Medicare supplements, you need to position the Medicare supplement in a way to say, yes, but with Medicare Advantage, you may be out of pocket $6,000, $7,000, $8,000, depending on what the maximum out of pocket is. So basically what you're deciding is whether or not you want to pay now if you want to pay now in small monthly payments, or if you take the chance and you risk it and you want to pay later when something major happens to you. And so that, that's something to consider. And so, but if they've already said, I can't afford $100 a month, you want to, and if you're only selling Medicare supplements, this goes back to what I call the symptom of a call when it comes to your telemarketers. Because if you're getting more and more people that are saying, I can't afford a Medicare supplement, you want to make sure that you bump that income up a little bit when you pull your data. So that way you don't run into that part of it as much. And I mean, I've been doing this for 12 years, and my marketing has always been geared more towards Medicare supplements. Here recently, I'm not being as picky anymore, and I let the client, regardless of whatever the income is, I stopped filtering that part of it out and just let the conversation go wherever it goes. And then if they go with Medicare Advantage, I can help them with that. I just need to make sure that I stay compliant. And I do whatever I need to do to do that. But if, let's say, there's, that I just need a Medicare Advantage plan, you want to make sure you have some kind of referral partner or some kind of somebody that you can refer that business to. But if you're an agent that does more original Medicare and a Medicare supplement, and you deal with people that travel and go see their grandkids and so on and so forth, and they can afford the $100 a month, then you say, oh, congratulations. Looks like you made your first decision, which is you don't want Medicare Advantage. And then you say all the stuff that you've been getting in the mail, anything that says HMO or PPO on it in your brochures that you've been getting, you can put those off to the side, because anything that has HMO or PPO on it is a Medicare Advantage plan. And so now you only want to focus on the Medicare supplements. So if you have something from United Healthcare, Blue Cross Blue Shield, all that's related to a Medicare supplement. And Medicare supplements have to be labeled Medicare supplement insurance. Medicare Advantage plans don't, if it's not labeled Medicare supplement insurance, the chances are that it's a Medicare Advantage plan. And so if they say, well, why would a lot of times, depending on how I position it, people say, well, why would anybody ever take a Medicare Advantage plan if it has all these restrictions and so on and so forth, blah, blah, blah. You say, well, not everybody can afford a Medicare supplement. And Medicare Advantage plans, I mean, they do a great job, but they're not for everybody. And to me, it sounds like you're leaning more towards a Medicare supplement than a Medicare Advantage plan, because you travel more or whatever their situation is, right? So you have to tie in their personal story based on your warm up and the first couple minutes of your conversation. Well, I travel a lot, I go see my grandkids, I go out of state, I go out of country, whatever have you, right? I'm a snowbird where I go from New Jersey, Pennsylvania down to Florida, which you guys get those all the time. So depending on what they told you during the last couple of minutes of you talking to them, you say, well, it sounds like Medicare supplement is what you're leaning towards. So you've basically made your first decision, which is you don't want a Medicare Advantage plan and you want a Medicare supplement instead. And they say, yeah, I think that's right. Okay, well, let's go over the different Medicare supplements, and we'll talk about prices, how they work, the different plans, and then we'll talk about what that looks like. Do you have any questions so far? And so they say yes or no. They may want some more clarification, whatever have you. And then you say, okay, so let's talk about the different Medicare supplements. And then the thing is, you want to make sure you already have your quotes pulled up, which you already talked about that before. And I always talk about, because there's 10 plans to choose from, but I only talk about Plan N and Plan G. And really, a lot of these companies don't want you to push the other products anyway. So like even Plan D, I don't see a lot of agents pushing Plan D, and a lot of companies don't really price Plan D. I don't want to say the word fairly, because that's not a good use of words, but like a Plan N and a Plan G, why would you could do a G over a D and probably pay less, you know?
Yeah.
So when you say, okay, so what I'm going to do, I'm going to talk about the different plans. Now there are 10 plans to choose from. So on page, I got a sneeze coming on.
Hold it.
Missed it. Okay. So in the Medicare New Guidebook, if you have it, go ahead and turn to page. They just changed it on me. 75. And so on page 75 of the Medicare New Guidebook, it says that Medicare supplements are standardized. What that means is it doesn't matter which company you're with, a plan G, for example, or a plan N or a plan D is exactly the same regardless of what company you're with. So United Healthcare's plan G, Blue Cross Blue Shield's plan G, Mutual of Omaha, Cigna, Aetna, all their plan Gs are exactly the same. There are no network restrictions. So you can go to any doctor, any hospital that accepts Medicare, which we talked about before. And there's 10 plans to choose from when it comes to the different Medicare supplements. The two most popular plans are Plan G and Plan N. And so on your left side of the paper, under Original Medicare, under A and B, go ahead and write Medicare Supplement. And they'll write Medicare Supplement. And then you say, okay, so Medicare supplements are optional. You don't need to have a Medicare supplement. But if you don't have a Medicare supplement, remember that you're going to be responsible for 20% of your medical expenses if you don't have some kind of cap, which is what the Medicare supplement does. Then I explained to them why out of 10 plans, we only talk about Plan N and Plan G, the two most popular plans. And I say something along the lines, well, out of 10 plans, there's only 2 plans that are really worth talking about. All the other plans, the way they're priced, these companies really don't push the other ones because, and a lot of times you'll pay more to have less benefits like Plan K and Plan L. All those plans, 50% coverage, 75% coverage, are not priced, and I hate using the word fairly, but that's the only word that's coming to my mind. But a lot of these companies, the way they have priced these plans is they really want you to go with like a Plan G or a Plan N. And really those, based on the price versus what you're getting, are the biggest bang for your buck, and they're the 2 most popular plans. So what I'm gonna do is I'm gonna talk about Plan G first, then I'm gonna talk about Plan N second. I'm gonna talk about how they work and how they work with Medicare, and then we're gonna talk about how much they cost. So hold on just a second.
Yeah, no problem.
Okay, so we'll talk about how much they cost and the differences between the plans. So Plan G, go ahead and write that down. Plan G is very, very easy to understand. Once you meet your Medicare deductible, and so Medicare's Part B deductible is $233, and the way Plan G works is once you have A and B and G, and you've met your $233 deductible, everything else is covered at 100%. And so you can go to any doctor, any hospital that accepts Medicare, which, remember, like I told you, Medicare Advantage is not like that. And as long as they accept Medicare, the company that you pick really doesn't matter. And most companies, and most people pick the company based on the price. And that's what I want to go through next is the prices on Plan G. Any questions about how Plan G works? And like, I mean, the thing is, like, and you know this because you've been in the business long enough, like Plan G is very, very easy to understand, right?
Yeah, for sure.
So let me give you the prices for Plan G. So Plan G, and then you have the rates pulled up based on the companies that you represent and all that stuff. You say, okay, so I'm going to give you 3 prices on the same Plan G, just so that way you can kind of understand what I was talking about, where it's exactly the same coverage and there's the only difference is price. The first one I have is $110 per month, and that's with Mutual of Omaha. And I'm writing this down on my sheet so that way I can refer to the same numbers. And then the next best price is $112 a month, and that's with Aetna. And then after that, it looks like it's $125 with Cigna, and that's all Plan G. So between Mutual of Omaha, Aetna, and Cigna, there is no difference in coverage because Plan G is exactly the same. The price is between $110 and $125. Sometimes they'll ask, well, why would anybody go with the $125 when they can pay $110 for the same coverage? And you're like, exactly, because they make decisions based on a sales pitch. Maybe they only talk to one agent who happened to work for only one specific company, and they didn't bother shopping around, which we've seen that. I mean, we see that all the time. I talk to people who are paying by $100, $200, $300, $400 a year more for the same exact coverage because they didn't bother to do their homework or talk to a broker like me and see how I threw that in there a little bit because I want to build that credibility with myself, to where they didn't do their homework, so they're going to end up paying more. And so any questions on how that works? And this is where I'm like really, really, really checking in. Notice like between every like section now, I'm actually like really looking to get them to chime in and talk, because I've been doing a lot of talking here. And so I want them to think out loud, to process all this stuff. So that way, if there's any reservations, if there's any hesitation, if there's anything, like it can be voiced and you give them the opportunity to voice it versus like never checking in. And then you get to the close and you're like, oh, I got to think about it. And you don't know why they have to think about it because you never bothered to check in.
For sure.
So, okay, so that's how Plan G works. So let me talk about Plan N, and then I'll give you the Plan N prices. So Plan G, and so now even though we talked about Plan N, I recap Plan G quickly because of the way I position Plan N. But I say, okay, so like Plan G, where you have a deductible that you'll have to meet, which is $233. Once you meet that deductible, then everything's covered at 100%, right? Plan N works pretty much the same, except you're going to have a $20 copay at the doctor's office and a $50 copay in the emergency room, which gets waived if you get admitted. Any questions? No. Okay. So the other biggest difference between Plan N and Plan G is in some cases, you may be charged what's called an excess charge above and beyond what Medicare approves for a medical procedure. So a doctor has the ability to not accept Medicare assignments. So they'll accept Medicare patients, but they won't accept Medicare assignment, which which Medicare allows them to charge 15% above what is I guess a Medicare deemed price should be for any specific procedure. So for example, let's say the bill's $1,000, but Medicare says no, because I'm giving you so many Medicare clients, your bill should only be $300. And if that doctor accepts Medicare assignment, then he cannot charge more than the $300 that Medicare approved for that charge. But the doctor could accept Medicare patients, but not accept Medicare assignment. In that case, they can charge 15% above what Medicare approves for that charge. So if the approved amount, so the doctor wants to charge $1,000, the Medicare says no, you can only charge $300. The doctor says fine, I charge 15% above that $300. With Plan N, you'd be responsible for that excess charge. And Medicare has a website where you can go and search to see whether or not your doctors accept Medicare assignment. But that is the biggest difference. So with Plan G, everything's covered at 100%, no copays, no nothing, just your Medicare deductible. Whereas Plan N, you have a copay and you may be charged with a small excess charge. Now, I want to say that 96% of all doctors accept Medicare assignment. So it's very rare that this does happen, but we've seen it in the past. So let me give you the Plan N prices, 75, 85, 87, company. Any questions? And so they, they'll process it. They say, well, I mean, for an extra $10, $15, $20, $25 a month, I don't have to pay a copay. I mean, it definitely sounds like that's what I'm leaning towards. And again, this is where you want them to really process and think out loud, so that way any objections that may come up. And this will be very conversational, right? So it's very hard to script that part of it because there is going to be a lot of back and forth. But let them talk. That's the most important part. There's going to be a point where you're going to do a lot of talking. You're going to do a lot of checking in, but then there's going to be a part where they're going to just need to process and vent and think and all that stuff. And then based on what they're saying, just say, okay, so with Plan G, $110 a month, Mutual of Omaha, there is no copay. With Plan N, it's $75 a month. With Cigna, there is a copay. And of course, those excess charges. Based on this information, Ms. Smith, which way do you think you're more leaning towards? And that's my close. like I do the 2-option close, right? And based on what they tell me, well, I'm okay with the 110 a month with Mutual of Omaha. You say, okay, so that's them making a decision. And I say, so the process is actually very simple. What I do is I take your information, and I have most of your information. I take your information and I send it to whatever company you choose. That company then processes that information. I don't say application. I don't say signing up. I don't use salesy terms. Notice how I'm like dumbing it down. I take it and I send it, right? For instance, I'm going to fill out an application and we're going to apply for Medicare Supplement Plan G with Mutual of Omaha, robot. You don't want to sound like that. So instead I say, what we're going to do is we're going to take the next steps in the process are like this. We're going to take your information and send it over to the company that you pick. And they're going to process that information and set up what's called that crossover of benefits, where Medicare's primary and then the Medicare supplement is going to be secondary. And the process doesn't take much time at all. And I'm gonna go ahead and get that done for you. And I have most of your information, so I just need you to confirm a few things, and then we'll go ahead and get it sent to the company. Now, at this point, you would just do the application the way you've been doing it with the over 65. But it's so easy. And I don't know if you've ever done an open enrollment one. Well,
I've done a few. It's like awesome.
Yeah, it's super easy. But you never want to ask for information. You want to confirm information. So and that's what I say, I have most of your information. And really you do. You have their first name, their last name, their city, state, zip, their address. You have their phone number. You probably have their email address because you asked for it earlier, right? So you already have all that stuff. All you need is what? Medicare number, if they have it. Sometimes they won't. Medicare number, routing number, account number, social. You only need 4 pieces of information, and then their mother's maiden name in some cases, depending on the company. So I say, we already have most of your information, so I'm going to go ahead and confirm a few things and send it to the company and get this process all taken care of for you. Now, and based on what we were talking about, Ms. Smith, because it sounds like you said you were leaning more towards Plan G, which company do you think you want to go with? And they'll say Mutual of Omaha. And notice how I say, like, which company do you think you want to go with, or which company do you feel like you're leaning more towards? Like, notice how it's like not a non-threatening close. Like, I'm not trying to be like, hey, what's your decision? Do it now and forever, whatever. I don't do any of that stuff. So which way do you think you're leaning towards? Okay, now which company do you think you want to go with? And so once they say okay, so I'll send that information to Mutual. Now, when I ask for their information, I say, okay, so can you confirm? So again, confirm, right? Not ask. So your first name I have is Andrea. Now, your last name is Smith, just a common spelling. Yes. Okay. Can you confirm on your Medicare card how your name appears? And they're like, okay, let me go get it. Because you want to see, well, it's Andrea Smith. Okay. Do you know whether or not they have that whether or not they have your middle initial on there, or did they spell out your middle name? You know what? I don't know. Let me go get it. You want them to get up and go get it, because that's that commitment, that extra layer. Just like you did, hey, go get your pen and paper, get your Medicare and U book or whatever. Them getting up to go get it is like that next level, that commitment. But also, you're trying to get their Medicare card, right? And so they say, okay, so yeah, it looks like they use my middle initial. It's C for Charlene or whatever. Okay, now what is that number? And notice how I'm not like, what is your Medicare number? Oh, here, click, scam.
Yeah.
Okay, how does your name appear in your Medicare card? Well, I didn't get my Medicare card. Oh, okay. Well, how does your name appear on your Social Security card? Because it should match what it is on your social. I don't know. Let me go get it. So if they don't have the Medicare card, do exactly the same thing for their social. And with most of these carriers, you don't need their Medicare number to do an application.
Mm-hmm.
So let me go look. Okay, now what is that number? You mean my Social Security number? Uh-huh. And you just silence yourself. Like, don't sound nervous. And they just 235-725586. Okay, all right. Now, and you said your name is Andrea C. Smith. They use the middle initial. Okay. Your address I have is 123 street name. Is that right? Yes. Okay, that's in Lexington, South Carolina. Yes. Your zip code is 29073. Yes. Okay. Now I have your phone number is 803-542-5068. Yes. Okay, so now you got them saying yes, 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 yes. And then you say, okay, so now the next part is we have to set up the payment. Most of these companies do an automated bank draft. What day of the month do you want this to come out? The 15th. Okay. Do you happen to have that information? Not what is your routing number, what is your account number, right?
Yeah, for sure.
Have that information. Now, if they have their Medicare card, so if they have their Medicare card, and then you're like, well, I need them to get their social also. So if they give you their Medicare number, what's that number? They give it to you. What's the Part A effective date? Part B effective date, right? If they give that to you, but you still don't have their social, which you need, you say, now, does your Social Security card name match what's on your Medicare card? And they're like, I don't know. Let me go look. They get it. And then you're like, oh, okay, well, what's that number? And then they give it to you. Like, you don't ask, what is your Social Security number? What is your routing number? You don't want to ask for any of that stuff. You want to confirm, you want to verify, but you never want to ask.
Gotcha.
Then you wrap everything up, which, I mean, you've done applications before, so you know how to approach that stuff. Everything else is pretty straightforward after that.
Yep.
And then if I got to the rates and then they need to think about it, is when I send them that packet, that information packet that I was talking about, like the one that I have made up with my company, where in the back I'll actually fill out the rates and all that stuff before I send it to them. Like I'll actually handwrite it and scan it in and send it to them. I like that better than having it all typed out. It just gives it a little bit more of a personal touch. The other thing is I will text them. So in addition to emailing them that PDF document, I'll also text them the rates. And a lot of times what I do is, instead of typing out what Mutual of Omaha is, what Aetna is, what Cigna is, whatever, I actually take my cell phone and I take a picture of my screen, and I make sure to include in there Plan G, because it's in the top middle, and then the rates with the companies. Now, CSG has where you can X out all those small companies that have no rating or whatever, that you don't even want to bring up in conversation. You can take all those out before you take that picture. So the top 3 companies that you recommended are the top 3 companies on your chart. It just creates for less questions.
Yeah, for sure. Like, oh, why'd you not tell me that one?
Yeah, exactly. Like, I don't want to go over why you should not go with a company that's too new to measure. Like, no, like, I don't even want to bring them up. So the less rabbit holes you can go down, the better.
Gotcha. Cool.
Any questions? So I know I went through a lot, and I know I went through it fast, but I did that because it's going to be on the recording, so you can just kind of pause as we go.
Yeah, for sure.
But so so I gave you the script. So let me go over the process of the sale real quick, because that's how I actually wanted to start, but then I got sidetracked. So
okay, so you're gonna start? Okay.
Yeah. So that was basically my script. That's my process and how I go through it. But if you were to summarize all the different parts, what you're going to have is you're going to have fact finding first, right? Which is you finding out whether or not they're working, or if they're retiring, or if they have groups, because you want to get to know them a little bit, right? So you want to find out a little bit about their situation, but then you also want to have a warm up with them too, which is something that I skipped over. But usually the warm up is, so after I do the introduction, so you'll have your intro. Hi, this is Eugene giving you a call back. You spoke to my assistant about the information that you've been getting in the mail about your enrollment to Medicare. Where are you in the process of going through that information? That's your fact finding, right? So let them talk, let them vent, let them say, okay, here's what it is. I don't, whatever, right? So that's part of the warm up / fact finding. But then you say, okay, well, are you planning on retiring? Are you going to continue working? What's your situation? So you want to find that out, all open-ended questions. And then you want to get to know them a little bit too. So between that and you going into the rest of the presentation, you want to do a warm-up. So before presentation, so intro, fact-finding, warm-up, then the rest of the presentation that I gave you, and then the close, right? And then the application and so on and so forth. But during the warm-up, what I found really, really works for me for the warm-up is to, when I say, now I see your zip code is 29483, that's Somerville, South Carolina, is that right? Yeah. Well, how long have you been out there? And that right there is usually my segue into building that relationship.
Okay.
I cannot stress how important the warm up is, and I think you know this. I don't know how much time you take in warming up, but I found that with the 65 plus, because I've worked both markets, with the 65 plus, the replacement market, the warm up isn't as long as it is on my T65 presentations.
I can see that for sure. So I don't spend too much time on it.
Yeah, no, you don't, no. But with this, you do, and the warm-up could be in the form of your finding out about what benefits they're losing when they're retiring or whatever have you, right? About their work benefits, what does their insurance look like now? That could be part of it, like if they're a drier person, a little bit harder to warm up with. But even then, you can still ask things, oh, where are you retiring from? How long have you been there? Oh, you're in Somerville, South Carolina? How do you like it? Or whatever. And then that's your warm-up. Kids, grandkids. The other one I like to ask is, are you the only one retiring from your company, or is there a few of you that are retiring at the same time? Because that can then lead into referral situations, which I get a lot of referrals from my T65 people.
Cool.
Yeah,
that makes sense. That's pretty easy way to just kind of go off the zip code for the warm-up.
Any questions on your end? I know, like I said, I went through a lot, so.
Oh no, man, really helpful. Really appreciate it. Yeah, like I said, I'll rewatch it and everything, kind of try to absorb it as much as possible.
Yeah,
it's a lot harder. It's kind of like with the 65 plus, you just kind of show that you are knowledgeable in that first minute you're talking, and then they'll either kind of trust you from that or not.
Yeah.
And that's kind of what I've found, but this is a longer process for sure.
Very much, but it's definitely, I would say, double if not triple the commission. Which it should be, because you're spending the extra time. But the other thing, oh man, you just said something. Oh, so with the 65 plus, your credibility is through your knowledge, right?
Yes, exactly.
Your T65 is very, very similar with your education part of it. But in the beginning, when you're trying to establish credibility, because you'll establish credibility through the entire call, but it's how do you get to that presentation and talking about the different parts to Medicare, like you want to listen. My credibility is always where are you in the process? I'm calling you to go over that information with you. Where are you in the process? You get them talking, right? Let them vent to you. You listen. Yes, I hear that all the time. And then you say, well, here's what I can do for you, which is where I was talking about. And you don't actually say, well, here's what I can do for you. But that part where you say, well, what I'm going to do is I'm going to help you understand how Medicare works. I'm not a salesperson. I'm not going to try to sell you anything. You're going to make your own decisions, but we're going to help you understand and educate you on Medicare. That way you can make a decision based on facts, not a sales pitch. That right there usually helps elevate me and set me apart from the rest of my competition.
That makes
And it
sense.
really, 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 really works.
So I'm just curious, like when you're going through the calls, if you can get them just to kind of talk to you, you know, that first part's super important. If you can just break through that and you can kind of get into the presentation, would you say at that point, typically, you know, you kind of got it made at that point?
I'll close them.
Pretty much, yeah. You just gotta kind of get through that first couple minutes.
Yep. Yeah.
Really.
And then it's just a matter of finding out what their needs are. If they're leaning more towards Med Advantage, Med Sup, which Med Sup, which company. And notice, like throughout the entire process, it's you know, congratulations, you made your first decision based on, you know, what you told me. It sounds like you're leaning more towards Medicare Supplement, or sounds like you're leaning towards Medicare Advantage. Here, let me make sure I'm compliant and send you all the stuff, whatever. But the point is, none of it was, hey, let me sell you company XYZ, and this is what you're going with. It's always, let me educate you, let me show you what your options are, let me tell you what these companies are sending you, let me go over all this stuff, what you need, what you don't need, what you can keep, what you can throw away. That way you can make a good decision for yourself, which is why that credibility part in the beginning, that's why I went through that, because I think it's super, super important.
Yeah, for sure. This has been real helpful.
Cool. I know it's late. It's like, what, 10 o'clock now? So
Oh yeah, worth it though. Worth it.
yeah.
That first part, that's the golden nugget right there, though.
Yeah, I'll edit this, render it, edit it, and then send it to you. And like I said, I really appreciate your time. Also, I'm happy to help. If you
For sure.
if you type it up and you want me to glance at that script, I'll do it.